So, good evening, everyone. Thank you for joining us today. We are here continuing our awareness sessions on lung cancer. Last week, we spoke about a couple of issues on signs, symptoms, and living well after lung cancer is diagnosed. Today, we talk about the need for early diagnosis and why it's important to know signs, symptoms, and risk factors, especially as we increasingly see not just smokers, but also non-smokers get diagnosed with lung cancer. We are very privileged to have with us Dr. Chitresh Aggarwal, who's a medical oncologist at Paras Hospital, Panchkula. Just a quick reminder, Patients Engage is an online platform for patients dealing with chronic diseases and their caregivers, uh, allowing them to share personal experiences, information, and learn from each other, as also for healthcare professionals to engage with the community and inform them better so that they are able to make better choices. And really for everybody to be aware that, you're not alone in this, and others are also there in similar situations and can be supportive. We've always put patients and survivors at the center of our content, and we've talked to the relationship issues. We've talked about, how it impacts quality, cancer impacts quality of life, and you will find some of these discussions on our YouTube channel, recordings of those, as well as content on our website. Um, as I said in last week, we spoke on lung cancer, signs, symptoms, and risks. We talked of living well with advanced lung cancer as well. And you will find these sessions uploaded on our, again, our YouTube channel as well as our Facebook page. So you can see the recordings. And on Friday, we have 2 more sessions on lung cancer. So welcome, Dr. Chitresh. Thank you for joining us today. And I'm Aparna Mittal. I'm the founder of Patients Engage. I'll be the moderator of this session. Quick reminder that this session is being supported by Pfizer India. The content of this video is meant for informational and awareness purpose. It does not substitute medical advice. So please do consult your doctor for guidance based on the information you collect here. The views expressed are of the speaker and may not necessarily reflect that of either Pfizer or Patients Engage. Um, and as I said, we are doing this live on Facebook, YouTube, and on Zoom. So if you have any questions, do post them and we will try and pick them up. And you can reach us on any of our social media platforms. We are on Facebook, LinkedIn, Instagram, Twitter, as well as YouTube. And you can also find us on our website. So let's get started. Thank you once again, Dr. Chitresh, for joining us today. Increasingly, we are seeing, I think there was a news item today as well on how lung cancer is affecting not just smokers, but non-smokers as well. So can you start by letting our audience know what is lung cancer and what is its prevalence in India?
So I thank Pfizer for giving me this opportunity to spread awareness about such a common disease. Lung cancer basically is nothing but tumor in the lung. Now, every tumor or any nodule in the lung may not be cancer. So whenever there is some nodule or some a nodule or a tumor which is being seen on an imaging, we have to first confirm with the FNAC or a biopsy and confirm its diagnosis. And on histopathology, if it turns out to be cancer, then we label this patient as a patient of lung cancer. Now, we have to remember that lung cancer is a very broad term. There can be many types of cancers which are encompassed inside a common terminology such as lung cancer. Now, coming to the prevalence of it, most of the lung cancers in India are divided into non-small cell lung cancer and small cell lung cancer. And this non-small lung cancer can be further subdivided into squamous cell cancer, adeno cancer, or a combination of both adenosquamous or a large type cancer. So it is a fifth most common malignancy in males in India. And unfortunate part is that it is the most lethal one of it, because the patients, when they are diagnosed with lung cancer, they are usually at a very advanced stage. And despite best of the treatments, the 5-year survival of these patients is not much. So that is the unfortunate part of this disease, because despite there are many advances now in the field of treatment in lung cancer, but still we are not at a point where we are able to deliver this 5-year survivals to many patients.
Right. So, you talked of the various types of cancer. You talked of how it is, you know, it's the fifth cause of death among cancers. And are there gender in differences in prevalence of lung cancer?
So to answer that question, you have to understand that mainly, if you see the historical data, lung cancer was generally associated with smoking.
Mm,
And it was generally a disease which would affect elderly males who had a chronic history of smoking.
right.
So this is our understanding generally. And today also in our society, we have a very common question that if a patient is having lung cancer, the first question we ask is whether he was a smoker or not.
Mm,
But now what has happened is that over the previous decade, there has been a change in the shift of the incidence of lung cancers, because there is a slow decline in the squamous cell carcinomas or the small cell carcinomas, which are commonly associated with smoking. And there is an increase in the adeno component or adenotype of lung cancer, adenocarcinoma, what we call in our language, which is generally common in middle aged women, non smoking history, Asian population. And this is a surge in this subtype of population. So, there has been this change. And the what is the exact cause of this change? Nobody knows. So apart from smoking, what we tend to relate it to basically is indoor pollution, air pollution, then obviously alcohol intake is as associated with any cancer. Then there are theoretical risk factors like a history of silicosis, asbestosis, so silica dust particles being inhaled. So all these are general risk factors. But why a particular middle-aged woman who has been a non-smoker in her life got a adenocarcinoma? We don't have a real scientific answer for that till now.
right. Thank you. And you've talked broadly of the risk factors. Any other risk factors? Obviously, smoking, as you said, was historically considered one of the risk factors, probably still is. But and you've talked of some of the other risk factors related to pollution largely, but are there any other risk factors?
So, if what we apprehend sometimes is the passive smoking. Now, a
Mm,
patient might not be active smoker, but in and around the family or in the household, somebody is actively smoking, and ladies are taking that smoke, inhaling it. So, a passive smoking might be probably a very important factor, which is leading to all this. Then, in villages, still not every household has a LPG connection or a gas connection, and during cooking, they are using these fossil fuels, and especially the burning of wood or some other chemicals there. Inhalation of those chemicals also could be a risk factor for lung cancer.
right, right. And what are the typical signs and symptoms? Because you said it gets diagnosed late. So, if you could shed light on signs and symptoms so that people are more aware about
So,
it.
as I mentioned, and you correctly mentioned that signs and symptoms basically depend on what stage the patient is coming in.
Mm,
So, the general signs and symptoms of lung cancer is generally a nagging cough, which is not getting controlled over, say, 3-4 weeks, and patient is not getting relieved with chronic medications or local treatment. Then there is also sometimes a patient comes that there has been some blood spotting whenever he is coughing,
mm,
and there has been, some swelling in the neck, which we don't know the reason of. And if the patient is already advanced, the disease has already spread, then it could be the organs to where it has spread. Those symptoms can come in, like a chronic back pain, weight
mm,
loss, then headache and seizures, because lung cancer many times it affects the brain. And
right.
sometimes it can only have a symptom of unexplained weight loss, decreased appetite because the liver is getting involved, or it is a multi-organ spread where patient is already, too late in the disease. So these are the common spectrum of disorders or symptoms that we see. Now, as I previously mentioned, that the symptoms actually or per se would depend on what is the extent of involvement of a
Right.
particular patient.
Right. So typically what you're saying is in the early stages, the symptom should not be beyond like a cough or something.
So generally cough, hemoptysis, sometimes a change in voice because it very early affects the in and around structure. So there is some recurrent laryngeal nerve pressing happening in the mediastinum.
Hmm.
So change in voice, cough, hemoptysis, these are the classical signs or symptoms of lung cancer.
Right, right. And we've talked of early stages, late stages. Can you kind of talk through a little bit for the audience on what are the stages of lung cancer?
So for the audience or as a general public, what for any cancer, this is not only for lung cancer. Generally, the cancers are divided into 4 stages, 1 to 4. And
Right.
how we generally see it is if a disease is, suppose taking the example of a lung cancer, if the tumor is only confined to that part where it is involving, it is stage 1. If it is involving the opposite lobe, like lung, we have two lungs, right and left. So if it is, and each lung is divided into further lobes. So if the disease is spread from one lobe to other lobe and in and around these structures, it would be stage 2. If it is further spread to the in and around structures of the mediastinum or the lymph nodes, then we call it stage 4. And
Hmm.
anything which is outside that local area and has now spread to either bones, liver, brain, or there is accumulation of water in the lungs, in which we call it as pleural effusion, then it will be stage 4.
Right, right. And depending on the stage, do the treatment options vary, or is it the same?
No, so
Depend.
any cancer, the treatment would only depend on the stage at which it is being diagnosed.
Right.
So if it is early stage 1, 2, then generally we do the surgery of that affected part. We remove the affected part and the patient is almost cured of that disease.
Hmm.
But as I previously mentioned, that the number of patients who come in with curable disease lung cancer are very few.
Hmm.
So generally what we see in our practice is stage 3, stage 4 patients. For stage 3, generally the treatment is chemo plus radiation.
Hmm.
And for stage 4 patients, it is primarily chemotherapy. But nowadays, in the past 5 to 7 years, there has been, sorry, there has been quite an advancement in the treatments available for lung cancer. And
Hmm.
nowadays, we are treating at least 40% of our patients, not with chemotherapy,
Hmm.
but with oral tablets, oral TKIs, or immunotherapies, which are the
Right.
latest armamentarium available in the treatment of this disease.
Right. And these are only when those they test positive for genetic markers.
So it is not the genetic marker. What we do is that the tissue that we take out for diagnosis, that is biopsy,
Hmm.
we send it for some markers. No, those are
Right.
the receptors, or this is the PDL1, what we call in our language, medical language, PD1, PDL1,
Hmm.
and certain markers like EGFR, ALK, ROS, MET, BRAF, all these markers are there. These are important because against each marker, there is a tablet available.
Hmm.
And the general understanding is that all these markers that I named, they are the part of a signaling pathway. And through this pathway, only the signal is going to, for the tumor to grow. So
Right.
if we are able to target that pathway and we are able to give a tablet or a medicine against that pathway, that signal is stopped and there is a decrease in the tumor growth. And ultimately, you can treat this disease with that tablet.
Right. So do you now pretty much ask all of your patients to go through the testing necessary? And is that true for smokers, non-smokers, for the markers, this
Yes.
additional
So
testing?
anybody with stage 4 adenocarcinoma, we are doing all these markers. For
Mm,
squamous cell carcinomas, also sometimes some of these markers are done. And it is not a blanket statement because we have to pick and choose patients. But
right.
what is the general message that the people have to understand is that uh, you have to discuss it with your oncologist that what is the stage,
Mm,
what are the markers available, what all targetable mutations we tested, and are there any oral tablets or targeted therapies available apart from chemotherapy. with which we
Right.
can treat this disease.
So one question is that are these markers only for people who are non-smokers, or lung cancer patients who are non-smokers, or also for smokers?
So it is not dependent on whether you are a smoker or you are a non-smoker. It is
Right.
dependent on what type of cancer you are dealing with.
Right.
So as I previously mentioned, that it is not that only smokers will get squamous carcinoma and non-smokers will never get an adenocarcinoma.
Mm,
It is basically what is your report on the biopsy which would guide us how to get it further tested. Now we
right.
have so many patients who are smokers but they still get adenocarcinoma, and we
Mm,
have so many patients who are non-smokers and still they'll end up with small cell and squamous cell carcinoma. So
right.
the
So
distinction
there
to
is
offer
no.
a test or not to offer a test is not based on your smoking history.
Mm,
It is actually based on the biopsy report that we see after the tissue is taken out of that body.
right. Right. Um, a- and do you typically recommend this additional testing for markers before starting any treatment, or are there cases where you would start treatment and then decide to do this testing?
So again, it depends on the clinical condition of a patient. I will give two examples. Like
Hmm.
example number one, a patient where the disease has spread to each and every organ of the body, and we don't think that this man has to wait for 14 or 15 days till all the reports come in.
Right.
So what we do in such cases, we start off with chemotherapy, and that sense of urgency is taken care of, and
Hmm.
then we can always modify or we can add treatments to chemotherapy depending on the reports that pour in.
Right.
Vis-a-vis the second patient, example number two, where a patient though has a stage 4 disease, but the amount of disease inside the body is very less, or
Hmm.
the patient is young, he is not symptomatic, and we think that it is not going to harm in any way if we are going to wait 7 days to 10 days for all the reports to come in. So
Right.
actually it depends on the clinical condition, the age, the volume of disease, and the rapidity with which we want a response from a particular patient, that we choose what to offer.
Right. Right. Um, and you talked of the fact that there are more uh, kind of treatment options now available for patients in stage 4. Um, I know we have patient stories of patients who are surviving for, I think some are even over 5 years now. In your experience, what are the kind of survival rates that stage 4 cancer patients now have, if they are eligible for any of these treatments?
So the last line that you mentioned was very important: eligibility for a treatment.
Hmm.
Now, textbook wise or guideline wise, we might quote very fancy treatments, but we have to
Right.
accept that we practice in a country where finances and the cost of the treatment is the majority stakeholder in treatment decision.
Correct.
So, if a patient is available or to take all the prescribed treatments, then in stage 4 lung cancers, we can extend the survival to up to 5 years now or even more.
Hmm.
But it all said and done, practically patients do face challenges in the terms of finances, the
Right.
availability of the treatments, and on a general, I would say that 5 7 years back, this outcome of a stage 4 patient was around equal to 1 year or less than 1 year.
Hmm.
And now with advancements, we are able to take them to 2 to 3 years. But
Right.
if they're able to afford and take whatever treatments are being prescribed, then there is no end to it. Then
Right.
patients can actually survive a longer time.
Right. Right. And in terms of, while they are on treatment, what is their quality of life? Because, again, most lay people still get very scared when they hear of a stage 4 cancer diagnosis. So, if they are able to afford, what is the quality of life that they can also enjoy during this period?
So whenever we start treatment for stage 4 cancer, we have to understand it is an incurable cell.
Hmm.
We are not able to cure this disease. So it is just like
Right.
diabetes or it is just like sugar patient where we have to keep it under control.
Hmm.
So quality of life is the most important issue.
Right.
Now, if the aim was to just treat this disease, then we could give a 3 4 5 drugs together and take control of the disease. but the
Mm.
quality of life would go down so badly that
Mm.
the patient would not able to tolerate all this. So we generally do one or two agents of chemotherapy or a single tablet, or
Mm.
sometimes add immunotherapies for this spectrum of diseases.
Right.
And far or more, I would not say, but say 20, 15 to 20% patients do have some quality of life issues.
Mm.
But then what we counsel is that proper care should be done on diet,
Mm.
ambulation, motivation, and the patient and the family should be able to see the big picture. Big picture means that if they're able to tolerate these short term side effects for a couple of months, at least we are going to add some years to their life.
Mm.
So quality of life though is important, also we have to be very mindful of the responses in the disease. So it is a very fine line to balance these two, and then we decide on a case to case basis how to manage these cases on a case to case basis.
Right. And as far as you talked of the role of diet and ambulation, but can you elaborate on that?
So
Because
diet, there is no particular diet about it. So I don't say that you don't eat this, you don't eat this.
right.
What I tend to tell my patients is that they have to take small, frequent meals.
Mm.
It has to be a protein-rich, calorie-rich diet.
Mm.
And I come across many people who tell me that, sir, we have stopped eating wheat,
Mm.
we have stopped consuming sugar, we are
Correct.
only on wheatgrass diet.
Mm.
Somebody advised us not to take any form of grains or something, but we only take multigrain diet.
Mm.
So all this, extreme steps should not be taken.
Right.
Everything in moderate amount, whether it is milk product, whether it is sugar, whether it is oily fried things, whatever they want to eat in a common balanced diet, everything has to be consumed in a
Mm.
moderate manner, in watchful of the other conditions, apart from cancer. So if a patient is having diabetes, they have to be watchful for the sugar control, heart problems, hypertension. So all those things also come into picture.
Right.
But the general thing is that they should be eating each and everything in moderate amounts, in small, frequent, time intervals, so that they're able to tolerate these treatments.
Mm. Yeah, I think that's an important factor because, there is so much advice available on diet for people, especially on cancer, and so many messages that go out. That the fact that, you need to eat well to be able to, as you said, tolerate these medications, which are fairly strong medications, is something that, and, part of the reason you're taking these medications is to get an extended life with quality of life, right? So if you kind of uh,
So
put
it
so
is
many
just like
restrictions.
somebody telling, a 70-year-old man, you tell him, don't eat sugar, don't eat fruit, eat, don't take chapati, don't take rice. Then the question that we have to ask ourselves is that what is the quality of life of such a patient?
Mm.
And if you are adding couple of months or years to his life, is it really worth it?
Right.
So, quality of life is a very, I should say, a very difficult word to manage, and people have their own interpretations about it. So, but
Mm.
the message that should be taken is that patients have to be doing or taking whatever they have done all through their lives,
Right.
so that they are able to continue with their normal life routine. They should be pain free, and they
Mm.
should be having a simple ambulation, acceptable levels of ambulation, so that they are able to do their day to day activities. If
Right.
this all these things are able to do from my side, it is an acceptable quality of life.
So beyond ambulation, you do not see a role of exercise, or you do not see them being able to handle, I don't know what's the level of fatigue that they go through, for
So
instance. So.
see, the problem with all these things, fatigue, weakness, is that these are subjective parameters.
Mm.
Now, I don't have any objective parameter to assess that what is your level of fatigue.
Mm.
So, fatigue is a multifactorial thing. It can be due to patient is feeling depressed, he is
Mm.
not having good family support, he is not eating properly, he is scared of his disease. So there could be many reasons which ultimately the patient will come to you and saying that I am feeling fatigue.
Mm.
So
Mm.
that is the difficult part of management of fatigue.
Right.
So, what we have to do, the most effective therapy is reinforcement. We
Mm.
have to tell them that you have to be motivated. The family has to provide a good support to them. Again, the diet would play a main role. Sometimes meditation, yoga, some form of mild exercises would help. And then there are some medical therapies available, but those are not, that is on a case to case basis whether they would help or not. So
Hmm.
fatigue, weakness are such subjective parameters that nobody has a correct answer of how to manage it and how to
Hmm.
measure that what is the
Right.
exact involvement, whether it is due to the disease or whether it is due to the treatment of the disease.
Right. Right. And in terms of, you mentioned also how uh, motivation and depression are, kind of mental health issues are also a big factor, not just of the patient, but the family as well. So how do you, what do you counsel them as far as that is concerned, both the patient and the family?
So it is again the same thing. See, first of all, the problem in India is that many patients acceptance is a problem,
Hmm.
both from the family and the patient. So first and foremost is acceptance that yes, we have got this disease. The reason that why am I affected, what is going to happen, all these things are very scary because cancer is a life-changing word not only for the patient but for the whole family.
Right.
So they have to be told in detail the correct stage, the correct outcomes or expected outcomes, and then the possible side effects, and explain it to them that sorry,
No,
that
no problem.
it is not that everything is going to be life threatening, or chemotherapy is not a therapy which is going to put you on bed tomorrow. It is
Hmm.
just that they have to be mindful of the side effects. There are nowadays medicines available,
Sorry, do you need a
which
glass of water or
no,
something?
no, thank you. Actually, I am suffering from this due to change of weather.
Okay. Right. Right.
So basically, what is happening is that management of side effects, proper counseling about the disease, and again a positive, outlook to the family and the patient generally helps for the most of the patients to tide over this.
Right. Right. And since our topic was on how do you ensure early diagnosis, any final words to the audience on can, what can be done to
So,
uh,
what I would suggest are only two or three things
hmm,
which I think are most important. Number one, don't ignore your symptoms.
hmm,
This is the most important message. You go to a doctor, you get yourself examined, and let doctor say that you are not having anything.
right,
Don't assume and don't be scared of your symptoms, because a proper evaluation would not only lead to early diagnosis, but it will lead to saving many, many lives.
hmm,
Second, as we all know, smoking, tobacco in any form, and alcohol consumption are the greatest risk factors for any cancer.
hmm,
So quit smoking, quit alcohol, and adopt a healthy lifestyle, be stress free. And all these things are the general messages, not only for lung cancer, but for any cancer in general.
right, right. And any other messages to lung cancer patients who would be watching this?
Lung cancer, I think the good point is that there are many therapies available. There are too many advancements in this field. Go to your doctors, get yourself examined, and there is a whole new armamentarium or whole new level of drugs that are available, which is going to increase your survival by leaps and bounds.
Right,
So don't be afraid. Don't be in a negative mind set. Go and get yourself treated.
right. Thank you so much, Dr. Chitresh, for joining us today and for enlightening us on the risk factors associated with lung cancer, the signs and symptoms, the treatment options, and how to manage the difficult part of the disease as well. I think you've explained that really well to our audience. And to our audience as well, I think as Dr. Chitresh said that, for those of you who are not yet diagnosed, please do, stop smoking and live a healthy lifestyle. And for those of you who are patients, I think, or who get diagnosed, do remember that lung cancer now has many more treatment options as opposed to what it was a few years back. So don't lose heart. Do discuss with your treating physician and determine your options available. There is also under various government schemes now, options for coverage as well. So again, be aware of those and find those out as well. And another reminder that on Friday we are speaking again on lung cancer. And if you have any questions, please do send in to us. And thank you, Dr. Chitresh, once again for your time. It is at the end, after the end of your working day. So thank you so much once again.